Being brought up in the slum, hatukujua mambo ya matibabu ya meno. Anytime you had an ache, ni kuambiwa enda ung'oe. And most of my friends whom I grew up with walipoteza meno mingi. So tulikutana na Daktari Mary, who also introduced me to the dental part of it, being a businessman and an engineer by profession. Tulishikana, tukaanzisha hospitali ya meno sababu ya watu wetu.
Have you ever visited a dentist? Do you know that you should visit a dentist twice in every year? Come with me as we learn more about oral health at the Good Doctor Dental Practice. Every brand has a story. The practice manager at the Good Doctor Dental Practice, Steve Isiche Indimuli, gives us a brief journey of the clinic.
Our journey started in May last year, 2025, but initially tulikuwa Kibera, where I was raised, where I became a man, my community. That's where we started because tuli notice when it comes to dental practice, dental treatment, our people are left behind. Being brought up in the slum, hatukujua mambo ya matibabu ya meno. Anytime you had an ache, ni kuambiwa enda ung'oe. And most of my friends whom I grew up with walipoteza meno mingi. So tulikutana na Daktari Mary, who also introduced me to the dental part of it, being a businessman and an engineer by profession. Tulishikana, tukaanzisha hospitali ya meno sababu ya watu wetu within the slum. Tukatibu watu and now need to expand came because dental practice is expensive, especially when you're doing the private. Very expensive. The expansion plan ilikuwa jani mzito, but we all wanted this for our people.
We get to understand where the name Good Doctor Dental Practice came about.
The name Good Doctor, it was we got it funnily because we were discussing. Our previous name was Ayani Dental. But when we opted to come here after Daktari Sam joined us, ilibidi tubadilishe jina. But the main drive was, we are not doing this for money. As far much as we want money, we want to do this for our community and God. We want to be those good doctors who will give back to the society. And that is when Dr. Sam asked, then why can't we be the good doctors doing a good job for the Lord? That is how the name, the Good Doctor Dental Practice, came up.
The clinic is more of a home than a hospital.
On our reception, our waiting area is not any similar to any hospital in Kenya. That I can say with finality. You come through that door, you see home first before you see a hospital. That proves that we are unique in a way that we value family morals first. A home consists of a family. So any patient who walks in here becomes a family, a member of the Good Doctor Dental Practice family. That was our key drive, and that is why you see our facility ikiwa tofauti sana na zingine. Tuko na kahawa pale kidogo, tuko na mahali pa watoto kucheza, so that those young kids when they come wa feel kwanza it is home. Wakiona daktari hawatakuwa na uoga.
The Good Doctor Dental Practice is a level 3 dental facility offering these services.
After the inspections, we were given a level 3B dental facility. Do you know what that entails? It means we are a facility that is authorized by the government of Kenya under the Ministry of Health to do surgical under general anesthetic. So si tunaweza zimisha wasee, tuwatibu na tuwaamshe. Umepata? So those difficult surgeries, kama umevunjika jaw, tunatengeneza, tunatibu. Kama meno imepotea yote, tunafanya implants. Daktari wetu hapa is one of the best, if not the very best, and he's young, golden hands, working at the Kenyatta National Hospital too as a resident. The other procedures we do ni ya watoto, orthodontic, we do fillings, all those general orthodontic procedures we do. The kawaida general checkups za meno, oral health we do here. At the prices, let me not lie to you. Just like I'd said earlier, dental practice is expensive. And our ordinary people where I grew, most of them can't afford.
Operating a private business in this country comes with some challenges.
You know, when you're running a private facility, you're not funded. You're funding you. Rents are due. Uko na wafanyakazi. You are just next to your community that still believe huyu ni kijana wetu na alitoka, and we have to go to him and sort us, you know. So sometimes it's tough. We buy everything. Hakuna yule mtu atatoka aseme I want to support the good doctor dental practice with let's say even masks. They see us as a business, but deep down we know what we are doing is trying to make sure our people get unhealthy oral practice that they are supposed to get, even though they don't have that money. So inabidi saa zingine tunarudi kwa mfuko, but because tunaifanya na roho safi, we are happy and proud. Somehow God provides.
Dr. Samuel Ndeshimie, the head of doctors and the lead surgeon at the facility, highlights the importance of oral health.
Oral health is very important because we say the mouth is like the mirror of the body. So whatever that is happening in your body, inside your body, I can have 1 or 2 signs from your mouth. So if the mouth oral health is hampered, it means even the overall and the body, things are not right.
The anxiousness and fear around dental visits is dealt with professionally at the Good Doctor Dental Practice.
Techniques and current practice of care, especially at the Good Doctor, our first priority is painless, pain-free treatments. So patient should be at his or her comfort area so that the treatments are not that traumatic in a way that you will fear to come back for another visit. This time we have very many options, and also the technology has evolved from just injections. Now we have very painless injections. We have now introduced general anesthesia and also sedation in dental offices that we currently offer for people who have anxiety to come to dentist. So you shouldn't be fearing at this moment to come to a dentist because it is no longer traumatic.
The consequences of ignorance around oral health is greater despite being taken lightly.
Early diagnosis, better is the outcome. So please don't wait for toothache to come and to start seeking for a dentist. When toothache has started, it's too late. Second, people don't know that this dental disease can kill, but we have seen some incidents here in Nairobi where a person has died because of a tooth. It is not the first one. He's not the first one. Me as a surgeon, I see very many people like him. So most of patients, they come to hospital when it's too late. When we go apart from toothache and dental infections, we talk about dental oral cancers. You have an ulcer in the mouth that has refused to heal. You are going taking paracetamol, you are going taking antibiotics. It is not going to work. Please seek care when it is a bit, it's still early because when it is early, it is under control, so we can treat you. But when it's too late, the outcomes are not good. So be aware, go for dental checkup for at least twice a year. Brush your teeth twice a day, brush at least 5 minutes, and floss once before you sleep.
Unlike other businesses that are profit-driven, the Good Doctor Dental practice focuses more on the community.
We educate the communities on the causes of dental fluorosis and how to prevent it. If I may talk a bit about dental fluorosis, usually it develops as a result of taking too much water with fluoride and also taking in a lot of food with fluoride. So basically it is when a person is young, not when you are old. So when you're old, you will not get dental fluorosis if you don't have it. But when a child is conceived, it starts at conception and progresses on to when the child is developing. So when the child takes in water with fluoride, a lot of fluoride, and also food with a lot of fluoride, it accumulates in the body and causes something called dental fluorosis and also skeletal fluorosis. So when that happens, the teeth, you notice the teeth discoloring, especially when they start falling off. When the baby teeth are formed, they are white in color, but they are not discolored. Then later on, the permanent teeth that grow in the mouth are the ones that become discolored. So in very severe cases, that is when you find the baby teeth being affected. But in not very severe cases, you'll just find the permanent teeth being affected. So preventive measure, if I may advise, would be incorporating something called water filter in our homes, whereby you will put the water filters in the taps that we use so that you can cook with water that is filtered and also drink water that is filtered. So that will help us prevent, because we don't know where this water is going through. So sometimes we may have clean water, yes, but by the time it reaches your homestead, you're not sure it's clean. So when it goes through the water purifier, it becomes safe for your family to take and also to cook with. Yeah, so basically that is the most common conditions that we have experienced out there. It is very important for people to know when they should visit a dentist. A dentist is not visited when you have a dental problem. You should visit a dentist for dental checkups at least once or twice in a year. So it's recommended after every 6 months you come and visit a dentist, whether you have a problem or not, because sometimes you may have problems, but you don't know you have them. So when you visit a dentist for regular cleaning, that is one. The same way you take a car for service, you should take your mouth for service. So it's good for you to come. The doctor have a look, and then we clean the teeth. All the stains that are not out when you're brushing with your brush, we remove them. And then at least at that point, we'll be able to detect any issues that you may have before it gets worse, and we will be able to deal with them. The other thing is, it's very important for mothers to have education on oral health, especially when attending the antenatal clinics. So a baby as young as 4 months should be brushed. You should brush actually. We don't have teeth, yes, but you should clean the oral cavity, that is the mouth. So as soon as the baby finishes to take milk, that is suckling, you should take a clean cloth and clean the mouth. So that helps when the teeth starts erupting. They do not find a dirty surface. They find a clean surface. So I get a lot of questions, especially during teeth eruption, whereby mothers complain that when the teeth started coming out, they started coming out when they were black in color. And that is one of the major causes of something we call rampant caries, whereby teeth grow and then they start decaying immediately after they get into the mouth. And that's a very major problem. So mothers should be educated on how to clean the teeth even before the teeth get into the mouth. And immediately the first tooth appears, you should start brushing your child's teeth. That is as early as 6 months. So you should not wait until all the teeth are in the mouth so that you start brushing your teeth. You should start as early as the very first tooth. That is after like 6 months. Then don't do it for the child. You should train the child, and the best way to train, we usually say, monkey sees, monkey does. So when the the child sees you brushing your teeth, that child will start imitating how you're doing it. If you don't know how to brush, then you will be teaching this child not to brush in the right way. So it's very important for you to be very sure that you actually know how to brush your teeth, for you to teach your kids.
Looking ahead, what are your plans for the future?
We don't want to be renting. We want to do our own facility from scratch. We want to educate people about their oral health. We want to train young girls and young boys from my slum, my home, we call it the Chocolate City, about oral health. We want to see dentists, oral officers from those marginalized slums coming up. I want to do the first inpatient dental hospital that will train my young brothers, my young sisters to become professional in this field. I want to breed doctors, dental doctors, who will remember where they came from and elevate my name so that 1,000 years after I'm gone, I will still hear their echoes calling my name. We want the good doctor dental practice to live 1,000 years after we are gone. We want those roots to go down for the good work that it has done.
For more stories on brand and businesses, like, share, comment, and subscribe on our page.